All right, next, please. We've got a line here. Let's keep it going, all right, people? Great. Welcome to St. Louis General Hospital. How's your day? Okay, well, I guess usually they could have been better when you are at a hospital. So, let's take a look at you. This is your name, correct? Great. Don't want to be treating the wrong patient now, do we? Right, so if I see this right, you are here to see Dr. Collins. Right. Well, lucky you. He really is one of the best, at least in this hospital. Now, let's take a look. So, you are having what symptoms exactly? Okay. Sure. Sounds painful. Now, I'm just going to go ahead and walk through this form with you. Let me take a look. Okay. Great. Now, if you can go ahead and just put your full name right here and then your signature right next to it and today's date. Okay. It's the 5th? Yeah. Okay. Lovely. Now, I'm gonna go ahead and just ask you a few questions. These are just standard questions, but if you have a problem with answering any of them, let me know. If you don't understand the question, please don't just give a random answer. We cannot use that in our diagnostic team, okay? I'm glad you understand. So, on a scale of 1 to 10, how severe have your symptoms been in the past 5 days? All right. You poor thing. Well, don't worry, you're in really good hands here. While Dr. Colin is still busy, I will make sure to take very good care of you. So, let's see. And have these symptoms changed much in the past month? Okay. Well, that will definitely help us. Right. So, do you have any things that I should keep in mind when I perform a general physical exam? Any phobias, anything that you would be uncomfortable with? Got it. Don't worry, you're not the only one. A lot of people actually don't quite like that. Great. Unfortunately for you, though, I will most likely have to perform that procedure. But we'll see. Perhaps it isn't necessary. Just prepare mentally, okay? Good. Perfect. Now, I'm just going to go ahead and let you take a look at this. Is all of this information correct? Great. Any allergies we should be aware of? None. Perfect. Any underlying health conditions that you should let us know of right now? Not that you know. Great. Perfect. And lastly, Would you say that you are an interesting person? If this question is on the form, of course it is. These are part of our standardized mental check. You don't know. Okay, well, I guess that's also an answer. Great. Now, there's a few things that I need to check before we can start with your more specialized diagnostics, okay? So the first thing I'm going to go ahead and do is take your blood pressure. All right? Good. Now, usually there is a light pressure that can be felt around the arm. However, I personally feel like we get more accurate readings if we put the pressure on really, really, really heavily. So, if it hurts, maybe just a little bit, that could be. You can let me know, and I will try to comfort you through that. But this will be necessary for my, accurate readings. All right? Perfect. All right, so before I'm going to go ahead and start, I will just put on some gloves. Don't want you to get more sick than you already are now, do we? We don't want to get me sick either. So, I always like these, beautiful latex gloves. And they have a nice feeling to them. All right, other one. Great. You look nervous. Or am I misreading you? Do you not like gloves? Or is it something else? I'm not making you nervous, am I? I hope not. There's nothing to be scared of. I don't bite. Or perhaps you're nervous for something else. Well, whatever it is, you're rest assured. I told you you're in good hands. Any pain is going to be controlled and safe. I promise. Okay, great. So I'm going to go ahead and start off with taking your blood pressure. Okay? Good. So, I've got this thing right here. I'm going to go ahead and just attach it to your arm, okay? Okay, stick out your arm for me a little bit. Thank you. I'm gonna tighten it perfectly so it fits nice and snug. How's that? All right, good. Now I'm gonna go ahead and place my stethoscope just underneath there so I can listen and count the heartbeat. All right, so I'm gonna go ahead and just open the valve right there and start squeezing. I know it might hurt a little. I'm sorry. It's gonna get worse. And 3, 2. There you go. That feels better, doesn't it? Gonna let all the air out. Great. So now let's take a look what those results are gonna have been. Gonna take this off real quick. Your arm looks red. Did that hurt? Sorry about that. So sorry. Okay. Gonna roll that up and just put that away. Perfect. You did such a good job. You really did, I promise you. So, let me write down what my findings are. Let's see, that's 170 over 80. Okay. Right. Great. Lovely. Thank you for cooperating, and like I said, I'm so sorry that hurts. Wasn't my intention at all. You know, these are just really important numbers for me to get. Okay. I'm gonna go ahead and put those into my computer as well. Okay. And this is really easy. We put it into the system. The doctor can check it instantly, even before appointments and after. And we also have a computer check them and give us notifications when there are abnormalities in our measurements. Now, thankfully, your blood pressure seems to be relatively normal, so we should be good here. All right, let's move on. I'm gonna have to listen to your heart and lungs. I'm gonna go ahead and start off with your lungs. Now, I will ask you to remove your shirt for me. Go on. Go ahead. Please, I'm a nurse. Trust me. I've seen everything and anything. I don't think you're hiding that much specials, underneath that shirt. Go on. We don't have all day. I still have other patients to see. You're not that special. Although, you do have a cute face. I'm giving you a little extra time, but don't try me. Okay, great. So, this is going to be a little cold. Sorry. And I'm going to ask you to breathe in very deeply. Hold it. And deep breath out. Really push out all the air. Okay, good. I'm going to move my stethoscope and ask you to do that again. Deep breathing in. Yep. And deep breath out. Okay, now I'm going to check from the front. You can look at me, if you want to. I'm sorry, you just seem so nervous. I'm only assuming that you're nervous because of my legs. So, it's fine. Stare. I don't care. Now again, deep breath in and out. Okay, great. Good job. Now, I'm gonna go ahead and listen to your heart for a bit. Okay? You can just breathe normally. This is gonna feel a little cold on the chest. Did you just jerk back? It's not that cold. Calm down, it won't hurt you. Alright, be quiet. Huh. Your heart's going pretty pitter-patter, huh? No, that's not a medical diagnosis. I just mean... You really are one of my more nervous patients today. Why? Is it because you've noticed that I think you're interesting? As a patient, naturally. Anyways, so before I move on, I'm gonna go ahead and do some touching, make sure that all of your physical responses are as they should be. I do get your consent, don't I? Perfect. Now I'm just going to go ahead and go from head to toe. So I'm going to go ahead and start touching your head for a little. So if I press on your cheeks here with my fingers, right there. Okay, does that hurt for you? Any soreness? Any... Yes? Where again? Here? Hold on, let me press on that again. Here? Yeah, it really does seem to hurt you, doesn't it? I'm gonna need to check that just one more time, okay? Sit still. Perfect. Well, your facial responses are good. Seems like your facial expressions are good too. It's really easy to tell when you're in pain, which is cute. Alright, so I'm gonna go ahead and move on to your chest and shoulders and neck. So first off, your neck, how does that feel when I touch it like this? Feels fine? Any sensitivity, any other abnormalities? No? Great. Now, I'm going to go ahead and move on to your shoulders. Okay. This all looks and feels fine. Part of your back. Any muscle soreness here when I press here? Just a little? Nothing too severe, if I can tell by your face. And if I press a little harder? No, you're still fine. Okay, well, too bad. No, nothing. Let's take a look. So I'm going to go ahead and put some pressure on the chest area. It shouldn't hurt. Okay. No any signs of pain. No uncomfortable feelings. Nothing special. Perfect. Fine. Okay. Now I'm going to go ahead and put some pressure on your stomach as well. You have any problems with digestion? No? Good for you. On the sides of your body, also all fine? Okay. Perfect. Great. So, now that we got that out of the way, I'm going to go ahead and put that in the system as well. So, slight pains at facial touching. Okay. All of that. Perfect. Okay, now let's put that. Great. Now, I'm going to go ahead take your heart rate because when I was listening to it, it seemed pretty high. Okay? Great. Now, this is just going to be real easy. Just some stickers, electrodes on here. Okay. Great. Those are pretty secure. I'm just going to press on this button right here. And that's going to start measuring it for a little while. You can just relax. Nothing bad's going to happen. I promise. So far, this hasn't been too bad, has it? Of course it hasn't. Look, I keep my promises. I said I was going to take good care of you. Great. Now, I'm going to go ahead and stop this measurement. Great. Oh, wow. That's, did you just come from a workout or something? No. Have you experienced any problems with your heart lately? Anything out of the ordinary, really? No. So then I wonder what is causing your heart to act up like this. You are a little flushed as well. It couldn't be. Am I really making you that nervous? Perhaps they should have gotten a different nurse, huh? Not able to handle all of this? You know, it's fine. But it is messing with our measurements a bit, isn't it? So I need to know the reason specifically why I'm making you nervous. Right. Go on, tell me. This is crucial medical information. Do you think perhaps that I'm attractive? Or are you scared I'm gonna hurt you? Both of which would be fair assumptions, I feel like. Right. Got it. Now, unfortunately, because our measurements with your heart rate are a little disturbed by you getting the nerves from me, I'm gonna have to also draw some additional blood so we can get some more information on your medical state, okay? I'm sorry. If you weren't so physical in your response to me, I wouldn't have to do this, but, well, unfortunately, I guess I'm gonna have to stab you, right? Oh me, oh my. How. What a shame. Right? Alright, so go ahead and give me your arm. I've done this 100 times. Don't worry. Plus, your veins seem to be pretty close to the surface, making my job that much easier. Okay, I recommend you don't look. Tends to freak people out. And, well, you seem to be pretty easily freaked out, so just don't look, okay? Good job. Now I'm gonna go ahead and insert the needle after I clean up this part. Just gonna swipe this little cotton ball over there after putting a little betadine on there. There we go. Great. Now, just making sure this is properly clean. Rubbing the area. Great. And we're ready. 1, 2. Oops. Seems like I've missed. So sorry about that. Oh, don't be dramatic. It's just a pinch. Doesn't hurt that bad. Okay, I'm gonna have to retry though. 1, 2. There we go. My apologies. So, just gonna have to wait a little bit till I've gathered enough blood, and now you're good to go, okay? Great. So, while we're at it, could I ask for your phone number? This is just to confirm the information we already have and to make sure you are maintaining consciousness. I'm just going to go ahead and write that down. Let's see. Yeah, this will work. Okay, so that was. And a 6. Okay, great. And lastly, is that a 7? Okay, perfect. All right, seems like that is all good. Now, I'm gonna go ahead and take this out. 1, 2. There you go. So, I have gone ahead and entered all of your information into our system, written down some notes for the doctor, and he will be in shortly, okay? Trust me, you're going to be very well taken care of, and if you do end up having to stay for observation a little longer, I will ensure that I personally am the nurse to tend to your needs. All right? Good. Now, hopefully, everything's going to turn out just fine. I'll call in the doctor and I'll text you. All right. Bye, sweetheart. Hi there. Thank you so much for listening to the entire audio. Well, it isn't truly the entire audio. If you want to hear the extended, more not safe for work version, it is available subscriptions to there are greatly appreciated. So, yes, thank you again for listening. Lots of love.